Are you having mouth ulcer? Read some scary things on Google and wondering what it is? Why are you having ulcer? Hello friends, I'm Dr. Priyanka Sakhavalkar. I am here today to tell you more about mouth ulcers and how experts diagnose oral cancer. I am oral diagnosis, medicine and radiology specialist. So diagnosing mouth ulcers is a routine thing for me. So whenever patient comes to me, whether I tell them that it's a cancer or it's not a cancer, both the times they keep wondering, what is the basis of this? How did doctors tell me that this was a particular ulcer is cancer or is not a cancer? So today I'll tell you 4 steps which sequentially help doctors to diagnose a cancer. So first and foremost is the clinical history. Whenever any patient comes to me, I ask them history, that for how long this ulcer is there, whether it comes and goes, whether it stays there for 3 months or 3 weeks, or whether it heals and then reappears again, whether it is changing location or not. So all these different questions helps me to know more about history of the ulcer, whether patient has any history of tobacco, whether his patient is taking tobacco, gutkha, any other form of nicotine is also very important. So that is the first step. The second step is the clinical examination, where I actually ask patient to open their mouth and I examine the area of entire mouth and see if is there any other symptoms or signs that I see associated with ulcer. This can be whether there is any other mobile tooth, what is the size of ulcer, how its edges are, can I see any infection, or is there any other mobile tooth there, that I see visually. And also at times I palpate or try to feel the ulcer with my fingers. Also, there is another way where we examine whether we can feel any swelling here to see whether there is any extension of this infection or there is any possibility of cancer. So all these things come as the second step. So with these two important steps, we come to a provisional diagnosis, or you can say it is a temporary diagnosis, whether we are suspecting anything serious or we are thinking that it's just a routine ulcer. So after this first and second test, if I feel that no, it is something I need some more information about the ulcer, then I advise the third step, which is known as imaging or radiographic studies. Here, after doing 1 and 2, I advise patient to go for a CT scan or MRI. These imaging studies tell me what is the extent of this ulcer. Is there any involvement of lymph nodes? So all this helps me to come tentative diagnosis of a cancer. But for a final, but the most important test is the histopathology or the biopsy. If all these things are positive and still I'm suspecting that I need to be 100% sure that this is a cancer, then I advise patient to go for a biopsy. Now, what is biopsy? Biopsy is the test where a small portion of your ulcer or the tissue in your mouth is taken and it is sent to the pathology laboratory. We get the diagnosis from the pathology laboratory, and with this we are 100% sure that particular ulcer is cancer or it is not a cancer. So when all these 4 steps are met, then only we tell patient that it's a cancer. And this is the routine way with which it is diagnosed. So whenever you have mouth ulcer which is persistent there for a very long time, do not hesitate. Go and meet the expert. Speak with your oral medicine specialist. And remember, early diagnosis is the most important thing in fighting of cancer. So whenever you have mouth ulcer or any of your loved one is having mouth ulcer, don't worry. Okay, there are logical steps and ways with which we can diagnose ulcer, and once it is diagnosed, yes, we can fight cancer. Whenever we diagnose cancer in early stages, all the patients are recovering very well. Thank you so much.